Hi everyone, welcome back. So today I'm going to be talking about scoliosis. It's something that I see quite a few clients with, something that I've been told I have sort of a mild case of myself, which when I was told that kind of explained a lot when I looked at my sort of daily habits and how I move, and but also if you've looked at my video on how posture affects digestive function, you'll know that, you know, obviously your posture can have a knock-on effect on various other aspects of your health, and we'll sort of mention that a little later in this video. So the spine naturally has that S-shaped curve, which enables us to be flexible, to balance. It helps us with lifting and standing. But in those with scoliosis, an abnormal sideways curvature of the spine can occur, and this can cause pain, fatigue, and also breathing problems. Now, adolescent idiopathic scoliosis will affect 10 in every 200 children over 10 years old. It's the most common form, and it may be congenital, affecting infants, or degenerative, affecting older adults. Now, scoliosis is often overlooked due to its asymptomatic nature, but if it has been identified, massage therapy can be quite an effective way of slowing progression without surgery or having to wear braces. For those with scoliosis, standing up straight isn't simply a case of retracting the shoulders, contracting the abdominals, bringing the head back, you know, lifting the torso up out of the pelvis, because, you know, it may be that the hips and the rib cage may actually be asymmetrical, so it's just not that easy to just stand up straight. Now, if we consider how spinal curves are classified, scoliosis is generally classified by 4 degrees of severity. So we have, at one end of the scale, we have an optimal spine. So this is where there is no scoliotic dysfunction. Then we have mild scoliosis. So here, this will demonstrate a thoracic curve of between 5 and 15 degrees. Then we have moderate scoliosis, denoted by 20 to 45 degrees of curvature. And then at the upper end of the scale, we have severe scoliosis, which represents a curvature of 50 degrees or more. Now, scoliosis can also be classified by its reversibility, its severity, its etiology or cause, and the type and location. For therapists treating clients with scoliosis, the type of scoliosis is more important. So we've got 2 types of scoliosis. First, we have functional scoliosis, or otherwise known as secondary scoliosis. So this is where spinal curves improve with forward bending, side bending, and specific rotational movements. It's characterized by an asymmetric position of the trunk and back. It may become fixed if left untreated due to muscle guarding, where the brain will compensate for that asymmetry by adapting length, tension, balance in the tissues. Now, if these postural compensations continue, the adjacent tissues will weaken and symptoms will then start to become apparent. You know, and as therapists, we see sort of muscle compensatory patterns occur all the time. Functional scoliosis is a physiologic posture that arises from weight bearing one leg while standing. So often there'll be that lateral pelvic tilt. And if you've not already watched, do take a look at my videos on pelvic tilt. Now, functional scoliosis can become pathological if it becomes habitual. The natural presence of defects in muscles, ligaments, body alignment, nutrition, or structure of the bones will determine how people naturally sit or stand. The second type of scoliosis is structural or fixed scoliosis, otherwise known as primary scoliosis. Now, in these cases, the spinal curve does not straighten during bending or rotational movements. It's often accompanied by functional changes in the thoracic and abdominal organs, often involving psychological and emotional disturbances. The amount of functional change in the heart, lungs, and other internal organs is directly proportionate to the level of physical deformity. Symptoms such as backache, head or neck pain, arthritic symptoms, chest pain, organ dysfunction are generally the things that lead people to seek help. Spinal curvature often also occurs across different planes of the body. So in the sagittal plane, we have hyperkyphosis and hyperlordosis. In the transverse plane, compensations are often referred to as rotations or torsions. And then in the coronal plane, scoliotic side-to-side curves are usually thought of as coronal plane deviations, but tend to occur alongside sagittal deviations. For example, scoliokyphosis, where the rib cage hump becomes more prominent while bending forward. Now, we're going to just mention something called rotoscoliosis. So this is where the base of the spine corkscrews headward as the vertebral column turns on its axis. Coronal deviations often result from some sort of leg length discrepancy or pelvic imbalance. So if we think about what causes scoliosis, curvature in females is 3 to 5 times more likely to progress into more pronounced postural issues. Also, genetic links. 70 to 90% of scoliosis is idiopathic, so there's no known cause, it's just one of these things that happens. Many idiopathic fixed scoliotic deformities are found to be compensations due to sacral or cranial issues, and that's why craniosacral therapy can be quite good for people with scoliosis, but we'll talk about treatments later on. Research has also shown a clear link between scoliosis and lowered bone density, and this may be due to genetics, estrogen levels, nutrition, exercise, drugs. And this, if we think about hormone levels, that may be certainly a factor in why women are 3 to 5 times more likely to develop progressive postural issues, as well as the fact, when we talk about sort of weight standing to one side and lateral pelvic tilt, so many women that I see, are having those sort of issues because, they're carrying a toddler on one hip, and they always sort of tend to do it on the same hip. So, we can see how some of these sort of lifestyle patterns and just to do with, this sort of female physiology, can sort of cause the differences in how it affects men and women. Now, causes of functional scoliosis. So this refers to a structurally normal spine that appears curved, potentially a temporary abnormality, which may be caused by a leg length discrepancy, spasmodic muscles, maybe inflammatory conditions such as appendicitis, and it's often accompanied by other signs of poor posture. So this could be rounded shoulders, a prominent abdomen, flat feet, forward head posture, spinal asymmetry. All of these things that again we see with pelvic tilt. So, you know, if we can kind of adjust someone's abnormal pelvic tilt early on, it could actually potentially, you know, discourage these compensatory patterns that could lead to a functional scoliosis. So there are common functional patterns that we see in clients with scoliosis. Clients with functional scoliosis will usually present with a predictable postural pattern where the following asymmetries are noted. So what sort of patterns are we looking at? So you've just seen in the diagram there, it could be that one foot is pronated while the other foot is supinated. The right arch, for example, if one arch supinates to try to level the ilia in the pelvis, but the pelvic bowl side shifts over the left femur and upslipped left ilium. So how our feet are positioned, in other words, you know, and we see this with people with flat feet, for example, it will affect the angle of other joints such as the knee and the hip and how balanced the pelvis is. We may see an upslipped innominate bone in the pelvis, which is the bone that comes around the top of the pelvis. Also, we need to look at the pubic symphysis at the front of the pelvis. Is it symptomatic scoliosis? There may be sacral torsion. The lumbar spine may be bent or rotated, and we may see compensatory thoracic scoliosis. In a forward bend, you know, one side of the upper back may be more posterior than the other, while at the thoracolumbar junction, you know, one side might be more prominent than the other. Usually the vertebrae in the curve tend to side bend in one direction and rotate oppositely. There may be one shoulder lower than the other. The shoulder girdle may be torsioned. There may be compensatory rotation of the atlas on the axis of the neck. And there may be side bending of the occiput on the atlas at the back, at the bottom of the skull. Now, all of these things are, you know, if you see a sports therapist, they should sort of pick up on these patterns. Now, I'm going to talk about what's called a type 1 group curve. So this is a functional scoliotic pattern where 3 or more consecutive vertebrae side bend to one side, rotating in the opposite direction. Also, short leg syndrome. Now, as we've said, asymmetry may exist in functional scoliosis without a leg length discrepancy, but leg length discrepancy rarely occurs without structural asymmetry. Short leg may be caused by a psoas imbalance, so that's your hip flexor, or hyperpronation. Younger clients often have a long C-shaped lateral curvature with convexity towards the short leg. Now, balancing the iliosacral joints can correct the short leg, allowing the spine to develop straight and prevent a more severe curvature, and also prevents secondary musculoskeletal changes from developing later in life. So this is where, you know, your sports therapist can come in and help to correct those imbalances in the pelvis before, you know, other compensatory measures kind of kick in. Convexity opposite the short leg indicates non-neutral dysfunctions in the lower lumbar vertebrae and in the lumbosacral junction. So, as therapists, understanding basic joint biomechanics is essential when assessing and treating scoliotic clients. Being able to identify joint coupling that causes abnormal patterns, so that the balance and symmetry to the spine and soft tissues can be restored. So if you're someone who has scoliosis or think you might have scoliosis, do ensure that you're seeing someone who is experienced in dealing with this. For example, in right thoracic scoliosis, the vertebrae at the apex of the curve are side bending left and rotating right, causing a convex hump at the ribs. Now, many therapists, when they identify a posterior bulge between the spinal column and the scapula in cases of thoracic scoliosis, will manipulate the overstretched paravertebral fascia covering the bony ribs, believing that they are releasing fibrotic muscles, but this can worsen the scoliosis. So again, ensure that you see a really experienced sports therapist. Now, in fact, there are many stages within a scoliosis treatment, which will include stretching the weakened erector spiny muscles along the spine, depressing the scapula, lengthening the latissimus dorsi, which come down the side there, releasing the diaphragm and the obliques, and stretching the inferior transabdominal fascial column to flatten the rib cage, lengthening the lats and stretching the scoliotic concavity, releasing the diaphragm, obliques and transabdominal column, and lower transabdominal column release. So all of these things, if you're a therapist watching this, are things that you need to look at doing, but only if it's within your within your sort of abilities and experience. So the main therapeutic principles of treatment for scoliosis is reducing gravitational exposure, using traction as a basic corrective force, applying pressure over the convexity of the curve, and creating myofascial extensibility to the concavity. More research, however, in scoliosis is needed to really explain the dysfunctional mechanics of the scoliosis. The search for more effective therapy continues, Postural distortions are being recognised at an early age, meaning that earlier manual therapy intervention can treat the scoliosis where mild to moderate, preventing progression. Factors such as environmental toxins, nutrition, general activity levels also need to be considered. Current treatment options include bracing, surgery, and physical therapy. Now, as we've said, that can also include massage. Massage can't cure scoliosis, but it may be able to treat the pain caused by spinal misalignment. And also, as we've said, certainly in functional scoliosis, correct some of those compensatory muscle patterns and, imbalances in the pelvis. Massage therapy is less common in adolescent idiopathic scoliosis, but offers several benefits to people with scoliosis and often works best when combined with exercise or bracing. So the benefits of massage for those with scoliosis include pain relief, increased range of motion, reduction in the scoliotic curve. It stretches and relaxes the muscles and the surrounding areas that may be compensating, increases blood flow to the muscles and tissues, promotes better sleep, and just increases body awareness. If you have had scoliosis surgery, however, medical advice should be sought prior to treatment. Now, there are various types of massage that can be used for scoliosis. Cranial sacral therapy, we mentioned briefly earlier on, gently stimulates the restricted spinal tissue, improving the functionality of the spine and reducing stiffness and pain. Deep tissue massage, combined with stretching and neuromuscular therapy, deep tissue can reduce back pain by increasing the blood flow to the back, helping to lengthen tight muscles. Swedish massage. Now, Swedish massage is a lighter massage. It can impact on, pain levels, along with headaches, insomnia, and shallow breathing. So if it's more a case of you're being affected by trouble sleeping, maybe due to some discomfort, I would say probably more in the earlier stages of scoliosis, then certainly Swedish massage may help. Sports massage is another one. Now, this is a more vigorous massage which can benefit those who have had scoliosis for years by easing those muscle restrictions and correcting those muscular imbalances. But as I've said, do make sure that you see a sports therapist who is experienced in this, and you're really going to be looking at someone who's done their sports therapy degree rather than just a sports massage course. Shiatsu, which applies pressure to specific points, can help to stretch, rotate limbs and joints. Myofascial release, which again goes alongside that sports massage, opens up stiff areas and connective tissue which surround the muscles. Also, Thai yoga massage, which is a dynamic bodywork therapy based upon yoga and Ayurveda, may also be quite beneficial, particularly in, those sort of earlier stages before all those sort of compensatory patterns kick in. It will just help really keep you flexible as well. So this has really been a very quick overview in scoliosis, but hopefully it's just given you sort of some ideas, particularly to you therapists out there who are gonna always, if you don't encounter a scoliotic client in your career, I would be amazed. And quite often people will come in with a mild scoliosis and they might just complain of backache. They might not even be aware that it is scoliosis. So hopefully this has just given you a bit more information to work with. But as always, if you want to ask any questions, you can either comment down below, you can contact me through my Facebook or Instagram. I'm on there as the Medical Massage Lady. If you're interested in training courses, do take a look at my website, www.medicalmassagelady.com. And of course, you can subscribe to my channel. There are lots of other videos on various issues, from medical conditions to sports injuries to pregnancy and disability, as well as psychological conditions. And I talk in all of those about how massage can help, so do take a look at those too. But for now, that's really it from me. So until next time, take care, and I'll see you later.